Thank you very much for that very kind invitation and introduction. It's a real pleasure to be here. And we're just having a little bit of technical problem, but I'm hoping that the slides are showing okay now. What I'm hoping to do in this presentation is just to really give an overview of our current understanding of post-traumatic nightmares, looking at prevalence and the nature of the nightmares, also the potential impact of sleep problems that might contribute to the way we see nightmares presenting. I'll talk a bit about the broader range of recommended treatments, but then specifically hone in on imagery rehearsal therapy. And during the course of the discussion, also think about directions for future research. What we know is that nightmares are very common after traumatic experiences of all kinds. And what I have on the slide here is just a few examples of different populations and looking at what we know about the incidence, prevalence of nightmares in those populations, ranging from community samples of around 20% through women and men who've been assaulted, veterans of combat, up to refugees and asylum seekers. And I draw your attention in particular to this last dot point, which this study by Liza Tao that found that 3/4 of refugees and asylum seekers living in Australia report sleep disturbance. So it's a highly prevalent problem. So I've no doubt that those of you who are working with refugees and asylum seekers will be encountering this with your clients a lot of the time. I've been doing some work investigating the nature of nightmares for quite some time. I was a bit horrified actually when I saw that 2011 date up there. This was some research that I undertook for my PhD actually. And what I did in this research was really interviewed a lot of different people just to understand the nature of the nightmares that they were experiencing. These were all people with PTSD. But we know that people with and without PTSD do suffer with post-traumatic nightmares. What I found was that the content of the nightmares really varied. When we typically think about post-traumatic nightmares as being accurate replays of actual traumatic events. But what I found was that there was a real mix of those sorts of accurate replay dreams, but also non-replay, where there might be some elements of traumatic experience that comes into the nightmare, but it's not the full event. And then the third type were mixed ones. So elements of replay and then elements of non-replay, sometimes symbolic, sometimes just more random elements that seem to come into the dreams. When we think about the affect or the emotional response that's associated with the post-traumatic nightmares, most were associated with fear, but also some had more prominent anger, anxiety, and grief. Importantly, though, what I found was that it was generally the same emotion that was experienced at the time of the event as was experienced during the nightmare. And then there were some other features that were really interesting. The first one was related to body movement. What we generally find is that dreams are associated with body paralysis. So your body doesn't move when you're dreaming. But post-traumatic nightmares are different in that way. So people will often report that they're actually thrashing around in the bed or maybe even, moving out of the bed while they're having a post-traumatic nightmare. The other element that I think is really important is that the post-traumatic nightmares are associated with very vivid sensory details. So it's not just a storyline or a narrative of something that's occurred. It's very vivid sights, sounds, smells, taste, touch. So experienced as though it's really happening again. I've also undertaken some sleep studies trying to get a sense of what's actually going on while a person is having the nightmare in sleep, and are there particular factors of sleep that might be contributing to the presentation of nightmares. It's been notoriously difficult to actually capture nightmares when people go into sleep labs to have a sleep study. And part of the reason for that is thought that sleep study represents a relatively sort of safe place, because there are people around who could be sort of on guard almost, so that the person is more likely to sleep because they feel that there's some protection around them. And that means that they don't necessarily have the nightmare that they would normally have. But in recent years, there has been the availability of sleep equipment that's ambulatory, which means that it can be done in the person's own home or in an acute hospital admission, which is where the people were when in the study that I did. So what we did, we were able to get people hooked up to the sleep equipment, and then they would go to sleep not in the sleep lab, but in their own environment. And they had an event button that they would press when they experienced a post-traumatic nightmare, which allowed the nightmare to be linked to the sleep study, so we could see what was happening at the time of the nightmare. And we're able to capture 24 post-traumatic nightmares from 21 participants in this study. One of the really interesting things that we found was that, unlike normal dreams that occur in REM sleep, which is rapid eye movement sleep, we found that post-traumatic nightmares really could equally likely occur in REM or in non-REM sleep. In normal healthy sleep, REM makes up about 20 to 25% of our sleep. But in this study, most of the participants had less than 20% total REM sleep. Some had very little REM sleep at all. Another important finding was that 13 of the 21 were actually diagnosed with obstructive sleep apnea. So obstructive sleep apnea is a sleep disorder that can influence nightmares. Most of the nightmares that we captured in this sleep study were linked to hypopneas, which is events during sleep when there's a decrease in the airflow for at least 10 seconds. People sometimes, sleep partners will describe it, it seems like the person's just stopped breathing. So it's a temporary pause in the breathing. And a lot of our nightmares were associated with those breathing disturbances. They were also often associated with leg movements. 6 of the 21 people in our sleep study had ongoing muscle activity even during REM sleep, which is really unusual. And it's consistent with what's called a REM behavior disorder, where people can act out their dreams, for example, during REM sleep. So what does this mean? The first thing I think is that there may be subtypes of post-traumatic nightmare. So we might not be talking about just one phenomena, but more than one. Some of them may be more like a recurring bad dream, and others might be more like an intrusive symptom of PTSD that's actually triggered by being aroused from sleep, from a hypopnea, for example. Related to that, and the second point, is that effective treatment might differ depending on the type of nightmare. We can't always get people into sleep labs, of course, but it is important to be aware that not all nightmares might respond to our best practice sort of treatments. The third point there is the importance of a sleep study. If someone is having events like feeling like they're stopping breathing during sleep, or their partner reports that, it may be that there's an underlying condition such as sleep apnea, that if treated could improve the nightmares. So current recommended treatments for PTSD, if the person has PTSD, we would generally recommend that you actually start with evidence-based treatment for PTSD. Trauma-focused CBT or EMDR are the two key evidence-based treatments. Because if the person responds to those treatments, their nightmares may well improve. But if they don't, or if the person has nightmares without PTSD, that's when you might consider using a specific nightmare treatment. An imagery rehearsal therapy is the treatment that is generally recommended. That involves a re-scripting of the nightmare that I'll speak a little bit more about. From a medication point of view, prazosin, which is actually a treatment for hypertension, has been found for some people to reduce post-traumatic nightmares. And the thought is that the prazosin reduces the effect of stress hormones on the brain. This was an accidental discovery that people were being treated for hypertension actually reported an improvement in their nightmares. So imagery rehearsal therapy, in its simplest form, what this involves is having the person select a target recurrent dream, and recurrent is important here. If someone just says they have just 100 different nightmares and it's different every night, it can be very tricky to apply imagery rehearsal therapy to that dream, because you need to start with a consistent recurrent dream. The second is working with the person to decide on a change to the dream. And we're really here trying to look at ways in which the change can increase the person's sense of mastery or control over what's happening. And then the third element is having the person rewrite and then rehearse the change dream in their imagination. Theoretically, there are a few reasons why we think that imagery rehearsal therapy could be effective. And Isaac Marks really introduced this intervention back in 1978. And what he said was that there are three components of imagery rehearsal that are likely to be effective. The first is that there is an exposure component, that we are supporting and encouraging the person to confront the memory of something that has been traumatic and they might otherwise be trying to avoid. The second element is that there's a release of emotion or abreaction, as he would have used in his terminology. And the third is mastery, increasing that sense of mastery. Halliday, 1987, also wrote about what are the features of nightmare treatments that are likely to be effective. And he really argued that you need to address the features that cause anxiety. So those sorts of things are a belief in their importance. So people may have all sorts of beliefs about the meaning of nightmares and what they might mean and why they are important. So some of the discussion might be a gentle challenging if those beliefs are adding to the sense of anxiety about the dream. For example, if someone believes that their dream is a premonition of something that is yet to happen, that's a very frightening interpretation of the dream. The frightening storyline in itself is a feature of nightmares that causes anxiety. So what we're trying to do in imagery rehearsal is also to change the storyline. The perceived realism is a third element that we are trying to address by, again, changing the storyline, and the sense of uncontrollability. So we're working to actually increase that sense of controllability. And often when we first talk to people about this, there's a lot of skepticism about the idea that you can change a dream when you're asleep. How can you have that control? And we really ask people just to keep an open mind about that. What we do know is that if you rehearse in mind's eye the mental images that you want, they are more likely to actually occur while you're asleep. So there is that capacity for imagery control that we're making the most of. This is an overview, a summary of the steps that we use. So first of all, we do introduce relaxation first. We want the person to have a mechanism to be able to help themselves to relax. So often that might be a progressive muscle relaxation or a meditation of some sort, to practice that so that they're good at that. Then to choose a recurring nightmare that they'd be willing to work on, which means being able to talk about it, writing it out in detail, including all of that sensory detail. As I mentioned before, that's what we know about the nature of nightmares. They are very sensory, but also including the person's thoughts and feelings that occur in the nightmare. And then working to decide on a change to the nightmare, writing out the changed nightmare, and then rehearsing the changed nightmare and pairing that with a relaxation session. And this will often happen over a series of sessions, probably 5 or 6 sessions generally. I just wanted to make a couple of points here about important preparation. It's really important that in working with the individual, you make it clear that IRT, imagery rehearsal therapy, is really intended to change the nightmare, not the memory of the event or events. If this isn't clear, there's a risk that the intervention will be seen as trivializing the person's experience or disrespecting other people who were involved, including those who may have been killed or injured. So just really keeping clear that separation between, we're not trying to change your memory of what occurred. We are trying to change the way you experience that in your nightmares. And in writing out the nightmare, it's also really important to make sure that the person is writing what actually happens in their dream, not what happened in reality. And even though some dreams will be quite close to what happened in reality, there is usually a small deviation. It might start differently, it might end differently, there might be people there who actually weren't there in reality. Whatever it is, make sure that they're writing out the nightmare, not the actual event. It's important to recognise that writing out the nightmare in itself is likely to be distressing, particularly if the person has been avoiding talking or thinking about it. So it's important to have a really good rationale for why am I asking you to do this? And it really is that we need to get into that detail of what's happening in the dream in order to generate ideas for change. And the final point there is where possible, it's really good to encourage a bit of a light-hearted approach to the process of generating ideas for change. People are often very, because it is distressing and often they will have been having the nightmare for a long time, even thinking about it is distressing and is quite difficult to do. In trying to take more of a bit of a distance on it and taking a bit of a light-hearted approach, we are already intervening of changing the person's relationship to their nightmare so that it's something that they've put out there, someone else is talking about it with them, and it's no longer just that intense personal experience. It's something that they can look at almost from outside of themselves and examine a bit more objectively. When we start thinking about ways in which the person might change their nightmare, there are a range of categories that we would consider, and these include just making up a different ending, introducing a reminder that prompts different ways of viewing the nightmare, changing a threatening object into something that's harmless, using a distancing technique, or using any other reminders that this is just a dream. It's not actually happening again. It's a dream. I'll go through each of those in a little bit more detail. Before I do that, just the process of generating suggestions. I've worked both with groups of people working on imagery rehearsal therapy and one-on-one in individual therapy. So it needs to be adjusted, obviously, for that context. But in either case, really trying to encourage a creative brainstorm about ideas for change, because the individual themselves will often be very stuck and will find it hard initially to think about how can I possibly change this when it's based on something that really occurred. So having this brainstorming approach where, as a therapist, you might be throwing up some ideas. If you're working with a group, you're encouraging other members of the group to also throw in some ideas. But important that the choice of what the change is going to be is actually made by the individual, the dreamer themselves, because it has to be a choice that they're comfortable with. Whether it's their suggestion or someone else's suggestion, I don't think matters, but it needs to be something that feels right and feels okay to them. And when they're rewriting the changed version, it's important that that's written in the present tense, as though it's happening now. So I am in this XYZ environment I see around me, rather than the past tense, because that's how we experience dreams, as though they are happening now. So these are just some very high-level examples of suggestions for change. So making up a different ending, that can really vary from being very minor changes to highly imaginative. For example, the dreamer deciding that they've got superpowers and that allows them to escape. Maybe they can just fly up and get out of the situation, for example. An example of introducing a reminder that prompts different ways of viewing. It may be that they perhaps hold some feelings of guilt or shame about what they did or didn't do in a particular situation. And so in the dream, having a bystander there or someone who is a trusted person, reassuring them that they're doing their best. Changing a threatening object may be, for example, changing a gun into a water pistol or a car into a bumper car or a dodgem car. Distancing techniques can include things like having the person imagine the incident on a computer screen in black and white at a distance, something that really creates that distance for them. And then the last category of other only a dream reminders, things like just inserting something into the dream that reminds the person, that prompts them to remember that it's a dream. For example, just sort of in the dream, you look down and see that you're wearing your sleepwear and slippers. So the dream might be, the events might be occurring, but when you see that you're wearing your dressing gown and slippers, it's a reminder that it is a dream. So just a reminder then of when you go through that process of generating ideas for change, critical, as I say, that the individual themselves is the one choosing what that change may be. And for some people, they may be only comfortable with a very minor change, and that's okay. I don't think there's any right and wrong necessarily. And certainly if they introduce a minor change and they find that it's effective and their nightmare does change even that tiny little bit, they may be willing then to come back with a more adventurous or outlandish change the next time around. So it might be a gradual step-by-step process. But once that change is decided upon, we're going to be asking them then to rewrite the new script in detail. Again, all of the sensory detail, the thoughts and the feelings. And so that can be, if the first script that they wrote down of the original nightmare was, perhaps 250 words long, we want this one to be of similar detail. And so that it really brings it to life in the same way. Because nightmares are inherently distressing, what we usually try to do with the change is encourage people to introduce it as early on as possible once the nightmare starts happening. You have to let the nightmare start so that the rehearsal process is targeting that dream. But once it starts, as soon as they're aware that, okay, this is a nightmare happening again, as early as possible, we want that change to come in so that the nightmare takes a different trajectory. And then we want them to rehearse that. So what that means is not just reading through the new nightmare script, but it is reading it, but pausing and imagining it in their mind's eye, so that they are not just thinking about the storyline, but they are rehearsing everything about it, the sights, sounds, smells, etc. And then we ask them to do that each night before they go to sleep, and then do their relaxation after that. So what you're doing there is you're pairing the relaxation with the new, the changed version of the dream, and that in itself is reducing the arousal, reducing the anxiety associated with that change. For some people, this might have an effect quite quickly. I've worked with some people who just the process of writing out the change seems to be enough to shift something, and they start to experience some change in their nightmare, or they might just not have the nightmare again. For some people, there's more of a dose response where they might rehearse it for, every day for a week or 2 weeks before they start to get any effect. So it does vary. I would say generally, if it's going to be effective, you'll start to see some change, even if it's very minor change, within 2 to 3 weeks. And another thing I'd just add there is to really look out for any little sign of change, because what people will sometimes say is, no, I'm still having it. But okay, so tell me exactly what's happening in the dream. Is it exactly the same as the original, or has it even changed a tiny bit? And if it has changed a tiny bit, really use that to say, okay, that's showing us that change is possible. So let's keep going. So a lot of encouragement and reinforcement and looking for signs of change. Okay, I was thinking that was the last slide, and it was. So I don't think we'll actually stop for questions here, but I'm certainly happy to answer questions at the end. Thank you.